guys, so today we're going to be talking about a Foley care insertion during a PPH. Okay, so I'm going to go over step-by-step instructions on how to do it. Remember that this is a prerequisite to the in-service, so make sure to write down any notes. There will be step-by-step instructions at the in-service that you can take and follow along, as well as ability to practice with an actual Foley. Okay, so make sure you write down any questions that you might have and come prepared for that day to ask any questions. Okay, so first you're going to make sure that you verify the provider's order. Obviously in the PPH, the provider will usually be there, and if they are, they will say to you, hey, we're going to do a Foley or a straight cath, whatever the case may be. So just make sure that you do verify the order of what they want. That they want straight cath, do they want the indwelling catheter? It might depend on the care the patient's going to receive after the PPH, okay? So then you want to make sure you're going to check your patient's medical records for any allergies, specifically latex and iodine. It's also important to ask your patient too, as long as they're able to answer you. Always ask your patient if they have allergies, even if the medical record doesn't say so. Especially with the iodine, you can always confirm with your patient if they have any history of allergy to shellfish, because sometimes those are go hand in hand with the iodine shellfish, okay? You also want to gather any necessary equipment. So if you're doing a straight cath, make sure you get the straight cath kit. If you're doing an indwelling catheter, make sure you get the indwelling catheter kit. And you always want to get an extra pair or two of the sterile gloves just in case, okay? Then you want to make sure that you have an assistant, okay? You want to have someone that's going to be able to help you. This will be your buddy, and your buddy needs to be a registered nurse, okay? Your buddy cannot be an LVN or CNA, but they can be a registered nurse, okay? And that will be documented. There is a code word if sterile technique is broken, and we'll talk about that code word at the in-service, but if you know it, come prepared because there might be prizes, okay? You want to make sure that you have good lighting, that you're going to be able to see your anatomy, perform hand hygiene, confirm the patient's identity, okay, using at least 2 patient identifiers, provide privacy, and you're going to explain the procedure to the patient and if the family is in the room. During a PPH, it's a high-stress environment. It could be fearful for the patient, so make sure you do let the patient know what you're doing and why you're doing it, okay? You're going to make sure you raise your patient's bed to waist level where it's going to be comfortable for you. You don't want to be bending over too much because then you're going to increase your risk of breaking sterile technique, okay? Also, you're going to want to perform hand hygiene again, a lot of hand hygiene, okay? You're going to make sure you place your patient in the supine or the position where the patient's knees are elevated or bent and the legs are abducted. You also want to open at that point, once the patient's comfortable in that position, you're going to place the kit between the patient's legs. You're going to open the outer packaging of the insertion kit, and then you're going to make sure that if the patient is extremely soiled, you're going to have to cleanse that patient with like washcloths and soap and water beforehand, okay? Using sterile technique, you're going to open the insertion kit wrapper, the outer wrapper, okay? Now that you've already taken the big plastic one off, you're going to maintain sterile technique and you're going to put on your sterile gloves, alright? At this point, your patient should already be in position, your kit should be ready in between the patient legs, you have your assistant, the patient already knows what's going to happen, you already confirmed allergies, patient's order, everything. So now you're getting ready to actually start the procedure, so the sterile technique is super important here, okay? So then you're going to, once you have your sterile gloves on, you're going to place the sterile drape beneath the patient, and it's always going to be that shiny side down, and it's very difficult to see when you actually have it open. So usually when it's folded, you might be able to see like one side or the other, but make sure when you open it, you see that shiny side and the shiny side goes down, okay? You're also going to place the sterile finisher, you drape the one that has like that triangle, or it's not a triangle, it's a diamond, alright, over the perineal area to create a sterile field, alright? Then you're going to make sure you tear open the packet of the iodine solution. That's why it's important to confirm your patient's allergies. You're also going to make sure that the 3 foam swabs are ready and that they're saturated, and you want to make sure you don't spill them on the other equipment. So then at this point, if you're doing an indwelling catheter, you're going to have your 10 mLs of sterile saline, the syringe, filled, okay? And it's going to, you're going to put it at the balloon port. You're not going to push in, you're not going to test the inflation of it, because that could cause like micro tears in the catheter. So you're just going to have it ready. Then you're going to get your lubricant ready. So you're gonna, however the package might come, in the straight cap, I think just like you rip open the lubricant packet, it might be a little different for the drilling catheters, but you're gonna pour it in the little designated section of the kit, and you're going to take the catheter out of its packaging or the sleeve, and you're gonna make sure it sits in the lubricant. You have to be careful that you don't break sterile technique, that the catheter doesn't fly out and hit anything, that your catheter is going to sit in the lubricant, okay? Make sure it's in a good position because you don't want the catheter to fly out, okay? This is important that you don't break any sterile technique at this point. So now that you have most of your stuff ready, all right, you're going to now dirty your dominant hand, well, your non-dominant hand, okay? So for me, it's my left, as I use my left hand. So what you're going to do is with your non-dominant hand, you're going to separate the labia majora and the labia minora as widely as possible so you're going to be able to see the urethra, okay? And this is a very difficult task, especially if you don't have muscles in your fingers, because that tests your strength. I promise you, it tests your strength. So make sure you spread as far as possible and hold it, because you really don't want to move around. You don't want the skin and the skin to come back. You don't want your fingers to touch. You have to stay in that position to prevent any infection, okay? So then with your dominant hand, you're going to now clean. So the best way to do this is there's 3 of those iodines for a reason. So one of your iodines is gonna go to the labium furthest from you. Then you're gonna go the one closest to you with the second clean one. So you're gonna do the furthest, swipe from the top to bottom, swipe, discard. You're gonna do the closest, swipe top to bottom, discard, and then you're gonna do right in the center, top to bottom, discard. Always let your patient know that you're doing this, because it is an uncomfortable feeling that the coolness of the iodine might kind of be shocking for them. So make sure you let them know that you're gonna clean and disinfect, okay? The area first. So now that you have everything clean, always let your patient know that you're about to insert this catheter, okay? So maintaining the sterile technique, you want to pick up your catheter with your dominant hand, the one that is still sterile. This hand, or your non-dominant that's holding the labia open, is not sterile anymore, okay? You're going to hold that catheter, 2 to 3 inches away from the tip, and you're going to slowly insert the lubricated catheter into your urethra, okay? You want to make sure that you'll expect to advance the catheter without meeting any resistance. If you start to see like the urine flow, then you know you're in the right spot. For whatever case that if you happen to not be in the right spot, and if you happen to insert the catheter in the vagina, you're going to leave it as a landmark. You're just going to leave it there and you get a new kit, okay? You're going to make sure that you continue to hold the labia open, and you're going to continue to advance the catheter about 2 to 3 inches further to make sure that the balloon is going to be in the bladder, okay? If you notice that it's having difficulty with the urine flowing, you can always ask your coworker to gently put some pressure. Okay, then you're gonna, at that point, once you know that the urine is flowing, that you're in the bladder, you're going to inflate the balloon with the 10 mLs of normal saline or the sterile water. Okay. Now, once the balloon is inflated, you can ease the catheter back just a little bit, just gently, pulling the catheter until there's a slight tension, so that you know that the inflated balloon is in the bladder. Okay. You want to secure the catheter to the patient's thigh using the catheter securement device. All right. Discard any used supplies. Indicate the time and date of the catheter insertion, and position the drainage bag on a non-movable parts of the bed that is below the patient's bladder to prevent backflow of the urine. Okay. So we want to prevent any infections. We want to prevent cowdy. Okay. You want to return the bed to the lowest position to prevent falls. Remove and discard your gloves, any equipment, perform hand hygiene, and you always want to document your procedure. So I know this goes through step by step. It's a little tedious, but take notes, ask if you have any questions. Remember, if whoever can come and tell me what the code word is going to be with your buddy. If you do break sterile field, I want to know during the in-service. Come prepared with your questions so we can get through it and you guys can practice as much hands-on experience. Okay, thank you.